You'll see today that number dropped to 5,349. Still higher than we would like it to be, still a point of concern. Yesterday, we tested a record number of people. Over 101,000 people were tested in the state of California. Now north of 3.7 million, roughly 3.7 million people have been tested since the beginning of this pandemic. We've averaged over the last 7 days 88,000 tests in the state of California. While that is significant, it's not where we need to be. We need to continue to increase our testing, continue to increase our community, what we refer to as surveillance, so we can get a better handle of the total number of positive cases and understand the nuances between those with symptoms, those that are asymptomatic without symptoms, and those that are pre-symptomatic. But these case numbers, when you get a look over the course of the last few weeks, we are seeing roughly 56,000 new cases just in the last 14 days. And so points of obvious and real concern. Accordingly, we mark, as we've made this point on multiple occasions, consideration above all else to the total number of hospitalizations as it relates to people that are coming into our hospitals that test positive for COVID-19. Yesterday, I shared a slide with you that showed 29% increase in hospitalizations over a 14-day period. You could see from this slide, it's increased slightly to 32% increase in total hospitalizations over the last 14 days. We now have 4,240 individuals that are hospitalized as COVID-19 patients. Yesterday we shared, and I'll share it again today, a pie chart of the total surge capacity within our hospital system. This is an incredibly important chart, and this marks the efforts that we have advanced over the course of the last number of months, not just, again, to sit on our hands, but to address your anxiety and the legitimate concern we had to prepare for an increase in total hospitalizations. As you can see from this chart, some 52,745 surge beds have been identified that we can make available to meet the needs if capacity within our existing hospital system becomes stretched with COVID-19 patients. Like yesterday, today, roughly 8% of that capacity has now been absorbed. 8% of that capacity in terms of total hospitalization system capacity within our surge plan has been absorbed based upon the total number of positive patients in our hospitals. By the way, that hospitalization number represents a 3.5% increase compared to our previous reporting period yesterday. We look at ICU numbers, and indeed ICU numbers, not dissimilar to yesterday, are increasing. You'll see a 19% increase in this chart of ICU admissions over the last 14-day period. Yesterday it was 18%. So we're seeing a slight increase, 3% increase over yesterday, but over a 14-day period represents a 19% increase, 1,306 individuals within our total population of patients in our ICUs. This, represented on this pie chart, is roughly 34% of the available ICU beds within our system. If you compare this chart to the one I put out yesterday, we were roughly 29% or so of our capacity, or rather, excuse me, 31% of our capacity, forgive me, roughly in the ballpark, a few percentage points higher today in terms of that blue part of this pie in terms of the total capacity for two reasons. One, the increase in the number of ICU patients, but also a decrease in the total number, the universe of available ICU beds. Remember, that number changes day to day based upon the entire hospital system and the availability of ICUs for patients that come into the ICUs for multiple different reasons. Again, 8% on the hospitalizations of capacity, about 34% as it relates to ICU capacity in the aggregate for the state of California. And I'll remind you, as I always do, we do not live in the aggregate. And so these conditions are different. These percentages are different by county. And we encourage you, and I'll say this on multiple occasions in the presentation today, encourage you to go to the COVID-19.ca.gov website, COVID-19.ca.gov website, to take a look county by county at what is available, looking at those attestation plans, which are the preparedness plans put up by your county health officials in concurrence with your county representatives that attest to certain criteria and conditions before they can move further in to the reopening of their economy into these phases as they've been referred to. So that's an update in terms of the daily totals. I want to, though, go back and take advantage a little bit of your time today and talk about modeling. It can be a head scratcher, to be candid, going back months, watching all of these charts on the evening news and cable networks, people debating the methodology of these different models, people California using the UCLA models or the MIT models or the RAND models, or I can continue down this path. Many different models are put up, charts and graphs, waves, dots, and if you're like me, they can become profoundly confusing. And so today, I want to simplify what often you are presented, what you may look at and have your eyes roll, try to make some sense of it, and also to provide a framework in a moment where more people can participate in the modeling and avail themselves of their expertise to the collective effort here in the state of California, and we would argue across the rest of the nation, in improving our modeling capacity, making it more real-time, making it, more important than anything else, relevant in your lives. But the purpose of this model is to make 2 points. One is these models guide actions. They're not determinative of our future. You've heard me on multiple occasions make this point. The future is not just something to experience. We are not victims of fate. We can manifest the future. It's not something in front of us. It's something inside of us. I say this often. It's decisions, not conditions, that determine our fate and future. In the state of California, we are proof of that. You see this, one of the original models that was put out many, many months ago, very simple model that talked about no intervention, meaning you just rolled out of bed. We all just went along with whatever was thrown at us. And without any intervention, the expectation and the reality, as you've experienced in some states, that there would be a large surge or a significant increase in the surge of transmissions of the virus, and as a consequence, a big impact on the hospital care delivery system, on the healthcare delivery system. Interventions, what we refer to in technical terms as non-pharmaceutical interventions like stay-at-home orders, practicing social distancing, physical distancing, wearing a face mask, allowed us to prepare, protect, and promote, as we put on this slide, a different outcome. And as a consequence, because of the interventions here in the state of California, we were able to mitigate that curve, and we never experienced that sharp increase. But what we did do is we pushed out, because of these innovations, the growth of that curve, but more modestly, so that we had time to develop more capacity in our hospital system, more capacity to provide the protective gear that has become so important in terms of reopening our economy, and moreover, making sure that when people are in need of support and help, that we are there to provide it in a proactive, comprehensive, and thoughtful way. What we are doing today is not only trying to explain a little bit more about the modeling. Dr. Galley is going to come up here in a moment to do just that. But we want to open up the opportunity for more and more people to get engaged in helping us build our models, what we refer to in this slide as a model of models. You'll see that we currently have on our COVID-19.ca.gov website, and I encourage you to take a look at this site. And you'll see specifically, if you want to just go directly to the slide that I'm go to calcat, C-A-L-C-A-T, covid19.ca.gov. But this CalCat allows you the tool to get access to our models, these nowcast models, these forecast models, and then these larger models that run, frankly, just scenarios of planning. Dr. Galley is going to come up in a moment and explain a little bit of what forecast versus nowcast modeling means and how we've stacked all of these different models that I referenced just a moment ago together, and we've made them available on this site. But what we want to do today is something much more robust and significant, and that is we want to open up our site to netizens, as it's often referred to, of citizen scientists, people that are out there doing coding every single day. We want to give them access through an open source platform to all of the available data that we have, that I have, that our health professionals have, in a way that we don't believe has been done anywhere else in the United States. This is a deep dive for transparency and openness. This is a new resource that we're making available today. This open source resource is available at github.com/gov. You'll see at State of California, you'll see it on the screen there. We're making available the capacity for people to participate and help build our modeling capacity. Because one thing we recognize is the limitlessness of the capacity of expertise and talent that resides throughout the state of California, throughout the United States, and for that matter, throughout the rest of the world. The information that we're now making available is exactly the information we make available to county health officials. It's the information that guides the incredible work that Mike Wilkenine and DJ Patel have been doing on our team, these data expertise, the data expertise that they provide, second to none. It's the kind of work that they do every single day, where now we're opening up to all of you. We're opening up to mathematicians. We're opening up to people that are experts in AI, and opening up to our researchers and our scientists and our Nobel laureates and our partners across the spectrum, including, again, citizens that just have an expertise that hasn't been tapped, they haven't been asked, or they haven't availed themselves to the opportunity to engage. This goes beyond flat files, goes beyond, forgive me, APIs and more interactive, something that could truly bring to life a visualization of this data in a much more timely way. It's rather simple. We want to make the modeling more purposeful. We want to make it more efficacious. We want to make it more meaningful. We want it to promote a different outcome by promoting a different consciousness and ultimately promoting a different behavior. And, dare I say this, we want to back up the health professionals, because this is the data they use that guide their decision-making. And often that decision-making is questioned by pundits, some for good reasons, some for more mischievous reasons, more of an ideological argument or frame. We want to put all this out there, and we want it tested, and we want it challenged. And we recognize there's a reason this is not always done, is it will be tested and it will be challenged. And I think you deserve that. And I think we have a responsibility to advance that paradigm, that value, and that protocol. It's all about collaboration. It's all about engaging expertise. And as I say, many, many occasions, expertise can be found anywhere and everywhere, given the opportunity. And I think we've now afforded that opportunity. I think we're going to see some really dynamic and exciting things come from these new protocols and this new opportunity to engage in these new tools and ultimately help us engage in making protocols and process that help inform our guidelines and protocols and procedures, but more importantly, to encourage better individual behavior to back up the assertions that many are making about the critical nature of wearing face masks and continuing the social distancing and physical distancing required at this moment. Let me no longer belabor this. Let me now ask Dr. Galley to come up and make a little bit more sense of what these models may do, what they mean for you, for our decision-making, and again, how all of you can participate now in helping us inform our next steps in this pandemic. Dr. Galley?
Thank you, Governor. Good afternoon. I want to take a few minutes to talk about the 3 different functionalities or real benefits of the CalCat tool that we're announcing today. Real opportunity to get information that I've been using here with our team in California for months to guide some of the decisions at the state level. The exciting opportunity today is to not just have statewide information, but as we've built our understanding of the different models that you heard the governor mention from across the nation, to be able to use those at a much more local county level. We know that county health officers and health directors are using this information on a regular basis, not to sort of support their opinions, but to really guide their decisions that are driving some of our actions as it relates to our response to COVID-19. So I just want to walk through 3 slides. The first one is really an understanding of what do we mean by nowcasting, what actually goes into a nowcast. It's very much like when my kids wake up in the morning and say, what's today's weather like? And I say, look out the back window and understand what's going on. Is it sunny? Is it cloudy? And it helps us understand what is going on today at this moment. It's really built around this concept of the R effective, or that notion of rate of spread. We've talked to you before, the governor mentioned just last week, this idea of R effective, this notion that one infected person, if the R effective is 1, that person is going to infect one other person. If that R effective goes up to 2, it is 1 person infecting 2 people. And what we really want to see is an R effective that comes down below 1. And each bit above 1, so 1.1, 1.2, ends up growing our cases in quite dramatic levels. And that's when you see often those graphs or models that show the high, steep, almost hockey stick-like arc up. That is what we want to really work hard to avoid. And having this information, not just at the California statewide level, but to put it in the hands of people at the county level, allow this information to go into making decisions at that local level. The slide you see in front of you takes into account a number of different models that we've been looking at the state level. This is not California's own model, but that dark blue line that you see is actually the average of all of the other models that many of us are seeing in the news and in the press, and that we take our cues from. We believe that each of those models has strengths, and we wanted to put together a tool so that you can see the average, and those numbers get in the hands of local health officers and decision makers to guide future decisions. The next slide I wanted to go over is the forecast. This is very much sort of sticking with the weather analogy. This is like your 10-day forecast. This takes your current information, your current choices, and helps guide where you might be in the next few weeks. These are exactly the tools we see. They're built around that are effective for your communities, for your county, emphasize and reinforce many of the things the governor has been mentioning over the past many days, focused on wearing our face covering, remaining physically distanced, washing our hands, staying home when you're sick, and protecting the most vulnerable. Again, we have on our calcat.covid19.ca.gov have a tool that brings together many of the various models, allows us to look at various different outcomes of the decisions that we're making today. The third slide is really highlights one of the key benefits of the tool, which is allowing us to look at various scenarios. The governor highlighted that today's decisions help us understand a few weeks from now through our models where we might end up. This tool allows us to take our current data, whether that's our hospitalization data, our case numbers, understanding some of those non-pharmaceutical interventions that we have in place, like wearing your face covering, staying physically distanced, and where we will end up in the next few weeks and months based on those decisions. And so it allows us to model exactly how we need to design activities and choices for today to help us plan for the future. And between these various tools, we believe inviting a number of new individuals to play with the tools, make them better, challenge them, as the governor said, that we will, as we increase our progress in our fight against COVID-19, have improved tools and make even better decisions in the future based on our work together. And I just want to reiterate that these are exactly the tools that empower your local health officers and local health decision makers to prepare better for what we're going to see in the weeks and months to come and keep us as low risk and safe as possible in California as we continue to march forward in our fight